Standing with me is Sheriff Greg Champagne, St. Charles Parish School Superintendent Dr. Ken Ortling, Pam Roussel, GOSEF Region 3 Coordinator, James Como, Ron Johnson, and Dr. Deary with Access Health. Dr. Deary is an infectious disease specialist with Access Health. St. John Parish President Jacqueline Hotard, St. James Parish President Pete Dufresne, our entire St. Charles Parish Council, as well as the Director of Homeland Security and Emergency Preparedness, Joe Ganote. First, I'd like to thank the residents of St. Charles Parish for making adjustments to their normal lives and their Easter plans by continuing social distancing. We saw a lot of people making memories in unique ways on social media, people doing FaceTime calls with loved ones. So it was definitely a much more different Easter than we're accustomed to, but I do appreciate everyone's efforts on that. The coronavirus has affected everyone in one way or another, and I know that many of our residents and small businesses in St. Charles Parish are suffering, both financially and probably physically in health and mentally. Both the local and federal resources are being made available to individuals and businesses to ensure that people can put food on the table and that businesses can keep their employees on the payroll. I encourage our residents to utilize these resources made available by the federal government. Don't be afraid to utilize them if you need them. We need our residents to be fed, to be strong, and to be poised for success when everything is ready to go back to the way, back to normal. I've been working with my executive staff, the and our Economic Development Office to ensure that when the time comes to reopen, St. Charles Parish can quickly do so and ensure our local businesses are ready to thrive. The governor and other officials have noted that we are seeing promising signs in regards to the number of cases, and we hope that we will soon see the curve begin to flatten. As of noon today, St. Charles Parish has 460 cases of coronavirus and 24 coronavirus-related deaths. Our prayers and our thoughts go out to the families of the residents that we've lost in St. Charles Parish due to this virus. Last week, there was a New York Times article that I found very interesting. It listed 4 Louisiana parishes in the top 10 in the country as far as highest per capita death. St. Charles Parish was one of those parishes. Up until now, we have seen testing being extremely limited in our parish and throughout the entire region. This is in large part due to the lack of testing and processing resources available, not only in Louisiana, but nationwide. Over the past week, I've been working closely with Governor John Bell Edwards and our Emergency Operations Center to bring more testing to St. Charles Parish. With the closing of the federal pilot programs in Orleans Parish, and various locations were evaluated in the river region, and we were successfully able to move one of those sites here to Hahnville High School right off of Highway 90. Beginning tomorrow, April 15th, Hahnville High School will serve as a self-testing site for COVID-19 and will be operated by the National Guard in conjunction with Access Health. The St. Charles Parish EOC and St. Charles Parish Sheriff's Office will provide security through the duration of testing. As a self-testing site, individuals will be required to perform tests on themselves using a nasal swab. This is done to limit physical interaction between National Guard and the medical physicians on site. Instructions are going to be provided on how to complete this test. We will also be sure to share that instructional information via our website, our Facebook page, as well as our local access channels. So we want residents to be ready when they get here to be able to administer these tests. This site will be open 7 days a week, beginning tomorrow at 8 a.m. to 12 p.m. noon. Now, it starts at 8 a.m. If they hit the 250 test mark before noon, the site will close. Otherwise, it will go from 8 a.m. to noon. So 8 a.m. to noon, or until they hit that 250 test capacity. Testing will be open to all Louisiana residents 18 years or older. Make sure when you come to the site that you have your ID available. To access the site, people should use Highway 90 and turn onto Tiger Drive. You will then be directed through the parking lot to the testing areas and given instructions on how to complete the test. Throughout the entire process, you will remain in your vehicle and communicate with the National Guard or an Access Health employee through your window. Your temperature will not be taken on arrival. So if you've experienced fever, if you've experienced a cough, if you've experienced shortness of breath, please come and get tested. If you had symptoms and you no longer have symptoms, I'm encouraging you to come get tested. Once a test is complete, Access Health will contact individuals within 3 to 5 days with the results. Lastly, we're asking residents not to bring your pets, and please do not arrive on a motorcycle, as this would hamper the efforts of social distancing by exposing you to the folks here at the testing site. To speak briefly on the importance of testing, I'd like to invite Dr. Deary to provide some insight. Dr. Deary?
Thank you very much, Ron. I appreciate it. My name is Dr. Deary. I'm an infectious diseases doctor with Access Health Louisiana. I just wanted to say real quickly, I think that this is a great boom for the parish. Right now, Louisiana is number 2 in the country for testing per capita. So we've done a great job with testing. We could certainly do better. I would like to get to number 1. We're second to New York. So we can get to number 1, and it's things like this that's gonna allow us to do that, because the more tests that we're able to do, obviously the better. Knowledge is power, and trying to put that information into our hands is incredibly important. The other thing is that these tests are gonna help us find clusters of cases that exist here in the River Parish region. And once we find those clusters of cases, we'll be able to do contact tracing, and we'll be able to try to limit the number of cases that expand as a result of that. So I think this is a great thing for the River Parishes, it's a great thing for the state of Louisiana. And I want to thank you guys for the opportunity. Thank you.
Thank you, Dr. Deary. Leadership throughout the parish has worked collectively to ensure that this site gets set up and that the needs of our parish continue to get met throughout this crisis. That includes continued feeding and education of our children. It includes keeping our community safe. Dr. Ortling and Sheriff Champagne have done a great job at continuing the services that they normally provide through this crisis. I want to thank Sheriff Champagne for all that he's done to up the ante when it comes to patrols, and he put out a brief video yesterday on all the work that they're doing. I'd now like to turn it over to Dr. Ken Ortling to give us a brief update on the schools.
Thank you, Mr. President. Well, certainly it's been a pleasure to work not only closely with our parish president, our sheriff's office, but our EOC as well. We often say, and our motto for St. Charles Parish Public Schools is, you and I, we are St. Charles Parish Public Schools. That motto could not be more prevalent in our parish and throughout our school system. So thank you for having this opportunity for us to contribute to the health and safety of our residents as well as the residents throughout Louisiana. One thing Mr. Jewell mentioned was our feeding program. Last week we distributed over 11,000 shelfable meals for students, which included breakfast and lunches. This afternoon, in fact, we started about 9 o'clock this morning. We distribute once a week 5 meals that will last the entire week, or 5 days worth of meals, breakfast and lunch. We distributed hopefully over 11,000 today. I want to especially thank those community organizations that also help pick up and distribute to those families that cannot pick those meals up at our Performing Arts Center. Our continuous learning plan, or what we call phase 3 of online learning, continues. This phase provides additional learning opportunities for our students through Google Classroom, teacher web pages, and a host of other online platforms. Our teachers, administrators, and instructional staff at Central Office have been amazing these past few weeks. As part of phase 3, teachers will continue contacting students, holding virtual classes, recording videos, and updating learning opportunities with constructive feedback through the remainder of the year. We created an online guidance through a parent letter, as well as an at-home learning family handbook that our families can access to guide them in at-home learning, as well as our students. We distributed over 1,000 Chromebooks to students who we surveyed 2 weeks ago to identify those families that needed technology devices. We're in the process of continuing to distribute those Chromebooks to those needed families. Once we return from our break, which is actually this week, we're calling it Giving Break this week, since we're still here giving, Plans are being made to fill the additional requests from parents for those Chromebook devices. Finally, I want to give a special shout out to our Satellite Center and Desrian High School students. Those students are really doing something amazing, not only providing an opportunity for learning for our students, but actually making medical face shields for our medical community. Our Satellite Center facilitator Brian Goff, as well as our Desrian High School robotics teacher Brian Young, and their students have taken all of the 3D printers and placed them at their houses, and they're printing out medical face shields for those facilities. Shell has provided $7,000 worth of funding for this project, and to date we provided face shields to St. Charles EMS, 112 face shields to Access Health and Tulane Medical Center, and 25 face shields to Ochsner-Kenner. So once again, this is just one example of our efforts, our combined efforts, not just through parish government, but our students, and providing learning opportunities that truly model our mission of providing high quality learning opportunities for our students, while also contributing to our medical professionals and our heroes at this time. So thank you for being here. Thank you, Mr. Jewell, for the opportunity.
It's great to see our students doing that and stepping up during this time. One thing we've talked about is that this virus does not see parish lines, zip codes, and it's been proven to affect everybody in one way or another. For this reason, this site will serve as a resource for the entire region, not only the river parishes, but neighboring parishes in the Bayou region as well. The governor has recognized that the river parish corridor between New Orleans and Baton Rouge has become another hotspot for COVID-19, and we are hopeful that this testing site will help us limit the spread of the virus by providing more information about the effectiveness of our social distancing policies. In keeping with the spirit of regionalism, I would now like to invite my colleagues from St. John and St. James to give an update on their efforts in their respective parishes. And first we will have St. John Parish President Jacqueline Hotar.
Thank you, President Jewell, and thank you to the media for continuing to come out to the river parishes so that our residents can also get the information that they need. Sometimes when you're placed in between New Orleans and Baton Rouge, you're a smaller market, so I applaud media's efforts to get the information out to our region as well. Again, I would like to thank Matt Jewell for this invitation and also welcome my colleague, Parish President Dufresne. I want to thank them both for their leadership and for their continuous efforts to work on behalf of our region. We truly are better together, and this is one of our best examples. I want to send thanks to Governor Edwards and the Governor's Office of Homeland Security and Emergency Preparedness for spearheading the effort to expand testing in the river parishes and in the entire Bayou region. I'd also like to thank the St. John Parish Council's office. It's very different working with council members from a distance. I have communication with them daily, and I thank them for all of their efforts in getting information out to the public as well. And I want to thank the residents of St. John who have stepped up to the challenge of physical distancing. Staying apart is not something that we're used to, but if we buckle down now, we will be able to get back to life as we knew it much sooner. While we know that testing is not an instant solution for coronavirus, we know that testing will allow us to have a more accurate picture of what is happening in our community and how we need to proceed with fighting this deadly virus. To date, we have 562 coronavirus cases in St. John Parish and 48 deaths. We extend our condolences to all of those who have lost someone to this terrible disease, as we know each of them is a friend and a family member to someone and to us as well. In addition to this testing site, and the one that President Dufresne will discuss in Gramercy, there is also testing continuing to take place this week in St. John Parish. We have our Ochsner drive-through testing. No appointment is needed. That is Tuesday, Wednesday, and Thursday each week from 9 a.m. until noon. We also have our Tesh Action Clinic on the West Bank in Edgard. They are testing on Tuesday today from 7:30 a.m. to 5 p.m. and on Friday from 8 until noon. We encourage residents who visit the Tesh Action Clinic to call when you get there if you have coronavirus symptoms, and a staff member will come outside, so you don't need to get out of your vehicle. We have testing at the Urgent Care in LaPlace on Belterre Boulevard. Again, we encourage patients who have coronavirus symptoms to call when they get to the clinic so that a staff member can come outside to your vehicle. We also have Walmart drive-through testing. This is appointment needed. And this is Monday. It began yesterday until further notice from 9 a.m. until 4 p.m. We have the information on how to schedule an appointment for this drive-through testing on the parish website. We ask that our residents continue to stay informed through the parish website, through social media, our government access channel, the L'Observatoire. Please continue to stay connected. And let's continue to pray for our medical professionals, our first responders, our leaders, our parents, and our teachers. We are all experiencing major life changes right now. And we must now, more than ever, support each other and lift each other up in prayer daily. Together, we will get through this. Thank you. And I forgot one thing. I'm sorry. Introducing my fellow parish president, Pete Dufresne, St. James.
Thank you, President Hotard. And thank you. I'd like first to thank St. Charles Parish President Matt Jewell and his staff for inviting me here today to give me the opportunity to address my St. James Parish residents and also the residents of Region 3. It's unfortunate that we meet under these circumstances. However, it's always nice to see our River Region parishes come together to execute a plan that unifies our region and in this case responds to the COVID-19 crisis. I'm pleased to announce that we have secured a drive-through testing sites for our region, especially in St. James Parish. I'd like to thank our St. James Parish Hospital, the Louisiana National Guard, GOSEP, and FEMA for their support in assisting us in these efforts. St. James Parish site will be at the Gramercy Elementary School, located directly behind the Sacred Heart Catholic Church. Due to its ease of access and proximity to the St. John Parish line, this site was selected because it met the criteria required by the state and by the National Guard. I wish it were possible to have testing sites on both the east and west banks of our parish, but unfortunately, we were only allowed 2 testing sites for Region 3. After completing a walkthrough of our site yesterday with our EOC, we are confident that this site will be convenient and provide the resources needed to help track the behavior of this virus. We will have a soft opening beginning tomorrow, April 15th, for our first responders and our senior citizens aged 65 and older. Beginning on Thursday, April the 16th, the site will open daily for individuals 18 and over. The site will remain open from 8 a.m. to 12 noon every day. A site map and the list of procedures has been published on our parish's website and Facebook page. We are asking anyone visiting the site to please reference those documents and familiarize yourself with the location. And just a reminder again, no walk-up testing will be allowed. No pets will be allowed in vehicles. The testing site will not require a physician's order. The only thing you need to bring with you is a valid Louisiana identification. I'd like to thank our St. James Parish employees and those employees across the region for their hard work in providing the best resources and care possible for our residents. And I would like to also thank our residents themselves. To those of you who have been so cooperative and compliant during these difficult times, thank you. You are the reason we will flatten the curve and slow the spread. I ask that you please keep our river parishes and the state of Louisiana in your prayers. Let's continue to lift up and support our healthcare professionals, grocery store workers, and all the essential personnel who continue to work day in and day out, making sure all of our basic needs are met. Please, everyone, continue to stay safe, practice social distancing and personal hygiene to help keep our communities healthy. God bless you. God bless St. James Parish, and God bless our great region. Thank you.
Thank you, President Hotard and President Dufresne, for those remarks. Now we will have St. Charles Parish District 7 Councilwoman Julia Fisher-Perrier speak on behalf of the St. Charles Parish Council.
Good afternoon,
I just want to start off by sharing something that's pulling on my heartstrings here. Over 20 years ago, I was bouncing around the halls of this high school behind us at Hahnville, getting ready to walk across the football field to graduate. And a few years ago, my son was doing the same thing. And never did I think I'd be standing here in front of my alma mater on a Tuesday in April at 1 o'clock with an empty school behind me talking about a medical testing facility here. Our seniors should be preparing to graduate. The impact of this pandemic is heartbreaking in a lot of ways, but our leaders are trying to get a handle on this, and the testing site is just one more step toward normal. The site will mean access for the river parishes, and awareness of the virus is just one more step closer to getting back to normal. I want to share some statistics with you all. We're an industrial parish here in St. Charles, as you know. We have 53,000 people, 460 COVID positive cases as of today, as President Jewell stated, 24 deaths. Calcasieu Parish is also a very industrial parish and very similar to us in layout. They have 203,000 residents with only 273 cases and 14 deaths. I'll repeat it, 53,000 people here, 460 COVID positive, 24 deaths. Calcasieu, 203,000 people, only 273 COVID positive, and only 14 deaths. We've got to do a better job of social distancing, or we're on track to lose a lot more of our family and friends, unfortunately. I do want to thank the residents and the local businesses for doing their part. The businesses that are taking proper precautions, offering senior shopping, orders, pickup, delivery, and they're closing their doors even though they can't afford to, because they know we can't afford for this virus to continue to spread. Unemployment's on the rise due to this, and we're ready to get back to work. So I also want to thank the medical field and the first responders. We can't say thank you to them enough. You're putting your lives on the line every day for us. So we thank you and we pray for you. Lastly, I want to thank our leaders, local, state, and federal. The leaders are trying to do what's best for us every day. I want to thank the administration here in St. Charles Parish, of course, for working hard every day and working with the officials to get this site set up. I also want to commend my fellow council members. We've adjusted to the new normal, or we're trying. Our first virtual council meeting is April 20th. That's one way we're doing our part to try to flatten the curve and keep the parish moving while we stay at home. We're still here for you, you just can't see us. But I know we all miss our lives, and some of us are struggling to make it through this pandemic, but we've got to stay home. I'm going to end with some wise words that I read from someone very dear to me. In the end, it will be impossible to know if we've overreacted or done too much, but it will be quite evident if we underreact or do too little. Stay safe and stay home. Thank you.
Thank you, Councilwoman. I want to thank, again, the St. Charles Parish Council. They've been very supportive of the administration, have done a great job of helping disseminate information, so I do thank them for that. This has truly been a team effort, and continuing with thanks, I want to thank a number of people who have been working tirelessly over the past few days to get this site up and running. The Louisiana National Guard. I would like to thank Joe Ganote and our Emergency Operations Center staff, Dr. Ken Ortling and the staff at Central Office, Sheriff Greg Champagne, his entire staff for all they're doing, and again, the St. Charles Parish Council for their support. I'd like to personally thank Mark Kaiser and his staff at Access Health, who have been very, very responsive to me. And when I asked them if they could help with this drive-through testing site, they really just, it wasn't even a question of whether they could. They just said, what do you need? So we have a great relationship going with them. Lastly, I'd like to thank Governor Edwards and GOSEF and our Region 3 coordinator, Pam Roussel, for all they've been doing to help us get this set up and make the testing more widely available. And as well as our St. Charles Parish employees, who have done a great job of keeping all of our services going at this time. And really all, like Councilwoman Perry said, all of our essential employees throughout the parish who have been going to work during this crisis. Again, I want to remind the residents that we are under a stay-at-home order until at least April 30th. I know people are starting to get restless. I'm feeling the same way about this. It's getting old, but I know it's important that we continue to social distance and only go out when necessary. And please do remember to always follow the CDC recommendations as far as washing your hands and personal hygiene. And at this time, I will go ahead and open it up to questions. Numbers for St. James, Pete?
Right now, we currently have 211 positives and 13 deaths.
I just want to clarify, so are there only 2 federal testing sites, or are there?
Yes, the governor wanted 2 testing sites for Region 3, one on the West Bank and one on the East Bank. The West Bank location is here where we are today at Hornville High School, and the other testing site is in St. James Parish on the East Bank in Gramercy.
And are they both self-testing?
Yes, ma'am. Both sites are self-testing. They're set up to mirror each other. That way, any resident from Louisiana or Region 3 should decide to choose whichever site is nearest them. They can go to either one.
And this question's for anybody, whoever wants to answer it, but just, I know I tweeted that it was a self-testing site just a few minutes ago, and I already had 2 or 3 replies from people who are concerned just about if they're going to be doing the test right, or just worried that someone else isn't administering it for them. Is there anyone that could speak to just
Well, from what I understand, there will be a triage area set up when residents drive in. They will be instructed on how to perform the test on themselves.
Yeah, just real quick on 2 things. The testing in St. John Parish as well at Walmart is a federally funded program as well. So you really have 3 federal programs throughout the river region servicing both the East Bank and the West Bank. And as far as the self-testing goes, there's actually, you'll be given prompts once you get to the location. There's very detailed prompts on how far to insert the test and how long to keep it up there, how many times to swab. You swab, they'll walk you through all of it. So it's being done in a way that I think will allow it to still be effective even though it's a self-test.
So you encourage people, even if they had symptoms that have cleared up, to come be tested?
Yeah, that's what when we talk to the National Guard and we ask them, do you have to have multiple symptoms? Do you have to have one symptom? They said, if you come to the testing facility and remember, they're not taking your temperature anymore when you get to the testing facility. So if you had a fever yesterday and you tell them, look, I had symptoms yesterday, but I might not have them today, they're not going to turn you away. They're going to test you. So if you have symptoms or you had symptoms, recently, I would encourage you to get tested.
Thank you, and you're correct. The state has identified a cluster there. I don't believe they're still using that phrase or that terminology anymore. We have constant contact with the Louisiana Department of Veterans. It's a tragic situation, unfortunately. Cases and deaths, I don't have the numbers in front of me. We get an update every single day. Sorry.
26 residents, of whom 16 have passed away.
26 positive cases and 16 deaths at the Southeast Louisiana War Veterans Home. We receive that communication daily from their communications department, and we just continue to keep those families in our prayers, especially those who have served the country. We're very mindful of that, and we keep those residents in our prayers.
Obviously we've seen COVID-19 cases in a couple of our nursing homes. I don't believe anything is as bad as St. John has, but we are monitoring those situations very closely and in contact with GOSEF on those cases.
Any other questions?
All right. Thank you all for being here. Appreciate it.
If anyone needs to do any individual interviews, let me know. Get them at the podium so the mic stay live.